As you're all probably aware, due to the crazy parking situation, on February 4th and February 25th, there were mass vaccination clinics at the Farmington Civic Center. These clinics were set up all day to vaccinate upwards of 2,300 people. We spoke with Captain Jeremy Eidelman, a public affairs officer with the Missouri Air National Guard, on Wednesday, February 3rd, while the Air National Guard was preparing for the clinic.
So today we're setting up for tomorrow's mass vaccination event. So the Missouri Air National Guard is in a support role, and we're helping the Farmington community to help get vaccinated tomorrow.
All right. So who are the eligible people that are allowed to get vaccinated tomorrow?
So the people that are still in 1A and 1B, so typically people over 65 years old, or they have a health condition that requires them to get one. So I personally got my vaccine, and I did it to help protect my fellow soldiers and airmen, my family and my community. So I would encourage everybody to get a vaccine. We need to get to the point where we no longer have to wear masks and social distance, and the best way to do that is to make sure that we get enough vaccines out to everybody. As I said, the Missouri National Guard, this is what we do. We help to take care of the communities, and we're in a support role tomorrow. We're in a support role 100% of the time, but tomorrow specifically for the mass vaccination. We are doing this in all 9 regions of Missouri, and with the goal of about 1,800 to 2,000 vaccines per day per region. So we're just happy to be here, and we're happy that we could have partners, local partners like the Farmington Health Department, the Civic Center, and even the high school. So we appreciate you guys making accommodations for us to come through and get people vaccinated.
The following day, February 4th, we went to the Civic Center and were able to speak with Marcia Martin, a local resident who was just vaccinated. She had previously been nervous about the vaccine, but her concerns were calmed from the organization and friendliness of the vaccine clinic.
Were you at all nervous about the vaccine?
Yes.
What helped calm those fears, if anything?
My mother had the shots, and she's doing fine.
What would you like to say to those who had fears similar to yours, to encourage them to maybe get vaccinated?
I think that having the vaccination is going to help us, if we would have COVID later on, to be a milder case, not as bad. Hopefully that will save some people's lives by having a milder case if they get it. And hopefully the COVID virus can disappear with us having the shots.
We also had the opportunity to speak with Dr. Kirkley, a chief medical officer at Parkland Health Center. He spoke about the day's vaccinations and how they were being stored.
Today we have about 2,300 vaccines we're trying to give out, and the good news is that those same people that get vaccinated today will be scheduled for a follow-up second shot in 3 weeks. So today we're still following what the state guidelines have suggested on who can vaccinate. So we're vaccinating anybody who would be a first responder, anybody who works directly in healthcare, plus those who are over 65 or who have medical problems like diabetes, lung disease, kidney disease that would qualify. So the vaccine was brought in and unfrozen, and it's being what we call reconstituted. So it's being put into liquid and brought up to room temperature, and it has to be given within about 5 hours of sitting at room temperature. So far, the process of getting people through the front, getting them registered, and getting them the actual vaccine is probably taking about 8 to 12 minutes.
What do you have to say to those who are maybe nervous or anxious about getting the vaccine?
I would tell them that I understand, and that, specific concerns, I think they should definitely talk to their healthcare provider about questions they might have about the vaccine. I encourage my patients to get the vaccine when it's available to them and they feel most comfortable getting it, which does mean that some people are going to choose to wait, but most people will eventually choose to get this because I think it gives us a chance to go to school again without a mask on, to see our families, to not worry that getting together for the holidays is going to cause an outbreak, and I think we're all looking forward to that. I just want to say that when I see how well this has gone so far, that this gives me hope that our community, if we'll remain, let's say, guarded, patient, continue to wear a mask, continue to separate in the areas that we can, and when the vaccine rates come up, I think we'll see this disease get some control, and maybe we can all look forward to a better second half of the year if we can get there.
Although most of the staff and students are not yet eligible for the vaccine, we would just like to inform everyone that the vaccine is safe. It has gone through rigorous and extreme tests. If you are worried or scared about the vaccine, we encourage you to go to covidvaccine.mo.gov or contact your physician. As of recording, the state of Missouri has given out 1,046,607 total vaccines, including the first and second doses. 11.4% of Missourians have received their first dose, and 5.6% have received their second dose. This has been Michael Gopias and TJ Benoist reporting for BKTV News.